Psychoanalysis, Lacan for sane non-Lacanians. I have avoided discussing Lacan for the reason Lacan was a great thinker and also a crackpot, a sort of a neurotic genius. There are some very original, very rich, very profound things in what he has said. Equally, there is also a ton of garbage that he came up with. You feel after reading Lacan exactly the way Heidegger felt after reading Sartre. Lacan, because he gave primacy to language, has become very popular, especially in departments of language, linguistics, and literature. And I have seen multitude of people who could have otherwise become very good psychoanalysts getting lost into that garbage of verbiage. In spirituality, I ask people to keep away from J. Krishnamurti because few would benefit from him and most would get lost in endless pedantic argumentation, and life would just pass by and they would miss a promising opportunity. Similarly, I try to keep people away from Lacan because few benefit from him coming out of Lacan after going in by taking what is valuable in Lacan and applying that in psychoanalysis. Most get lost in the Lacanian verbiage and much of it is garbage. And then life passes by and you keep playing that verbal gymnastics for years together, losing your own life, your time, your career, and wasting your time in either something which is rubbish or repackaging or a half truth or a contextual truth. Right thing to do is to go into Lacan, find out the profound things, the good things, original things which he has said, bring it to psychoanalysis and enrich psychoanalysis with Lacanian ideas. If you wish to practice Lacanian ideas the Lacanian way, throw away the garbage from Lacan, the repackaging from Lacan. Just keep the profound original part of Lacan and bring insights from other schools into that Lacanian framework and practice there. I see people doing neither of it. I see people just getting lost into Lacan. And so I have not commented on Lacan till now. However, I believe there is interest, demand, questions from students. And so I'm discussing today Lacan for sane non-Lacanians, sane enough not to become Lacanians, and sane enough to recognize the value of Lacan, not dismiss him altogether, and enrich psychoanalysis with the original, the profound, the valuable that Lacan discovered, created, articulated. So this is like a short lecture for non-Lacanians to know in a very concise way ideas from the Lacanian framework which they can use to enrich their practice and do a more Lacan informed therapy or psychoanalytic conceptualization. We will not go into all the ideas of Lacan. We will not go into critique or supportive research into Lacan. What we will do is, in a concise way, in simple language, a few ideas from Lacan which I think are worth knowing, original, profound, rich. Understand those ideas and then enrich our own work, whatever way we are practicing, with those ideas. And this should be enough for most, and those who wish to explore in details can always do so with a caveat in the background, not to get lost into Lacan and not to get into idealization, de-idealization mode of idealizing Lacan and de-idealizing everyone else. And this hero worship leads to an endless reinvention of the wheel and worship of the rubbish. So with this song of caution, let us go into Lacanian ideas. Jacques Lacan was the French psychoanalyst, born in 1901. He was still 81. Trained as a psychiatrist, then as a psychoanalyst. Underwent his own analysis for 6 years, I believe, and started practicing. In the initial years, he was a great admirer of Freud and remained so till his end. He started with a very provocative thing. I should not say started with, but he, in the initial part of his speeches, his conversations, his writings, he used to liberally use this idea, this phrase, return to Freud. So after Freud, you had a variety of psychoanalysts, and Lacan recognized the value in the original. And this was to the credit of Lacan, that despite all the schools which came after Freud, many of which denouncing Freud, he saw the value of the timeless. And we have here a phenomena which we see in other areas also. In homeopathy, Hahnemann is to homeopathy what Freud is to psychoanalysis. And after Hahnemann, many schools of homeopathy came up, but every 30 years there is a return to Hahnemann movement in homeopathy. And we have a similar thing in psychoanalysis. Every 25 years, we have implicitly or explicitly a movement of return to Freud. And this proves the timeless value in much of what Freud said. Of course, that does not say all that he said was right and all that was to say he said. None of it. But there is a timeless value in many things that he said. Jacques Lacan was a great admirer of Freud, and he would return to Freud to reinterpret Freud with insights that he would get by bringing in knowledge of structuralism, linguistics, philosophy, culture, anthropology, and arts. He broadened the canvas of psychoanalysis, and he had great courage to do it. I don't think anybody before him actually had the courage to broaden the canvas of psychoanalysis to include all these areas which are necessary to be included in psychoanalysis. Beyond took a few steps in including epistemology, stopped after that. Jung took some steps to include anthropology, culture. He did not bring in epistemology, did not bring in linguistics. Lacan took that much wider step of enlarging the canvas of psychoanalysis by bringing in all these elements. And with this knowledge, he would return to Freud, read it again, and give it a new interpretation, a more elaborate interpretation that Freud had given. And much of his work of Jacques Lacan is from the period 51 to 81, 30 years of his work, and much of it came up in his seminars and in his books, writings. And very interestingly, in very early part of his career, he was fond of the phrase return to Freud, and that remained with him for much of his life. And he would always say, you may be a Lacanian, but I am a Freudian. And this, I should not say love of Freud, but let me say the admiration, almost a reverence of Freud remained with him throughout, far more than actually articulated. And towards the end of his life in 81, just a few months before he passed away, he participated in creating a Freudian field institute. And so we see, in one way, another Jung of the modern times, who no matter, this Jung was much different from the earlier one. The earlier one got into defiance and rejection. This one continued the reverence of the first father. And in these seminars, 51 to 81, much of his ideas slowly developed. And these ideas were recorded and came up as later publications. Lacan wrote his popular book, Ecritis, but much of it came up later in the form of publication of the seminars, interpretation, discussions of what Lacan said, and so on. Let us look at the theory of Lacan. Lacan was very fond of gnomes, and one of the gnomes he used was theory of Lacan does not exist, which means there is no one theory of Lacan. Every seminar he revises, and the theory goes on changing, goes on developing. There is no stable first premise that does not change in the Lacanian theory. And like Freud, he never came back to revising what he said in the light of later discoveries. There is another famous gnome of Lacan, which is desire is a desire of the other. So one meaning is you desire what you don't have, so it is the desire of the other. The second meaning is your desire is not genuinely your desire, it is precipitated, informed by, influenced by the other. So what you think your desire is partially, largely, or completely somebody else's desire, the desire of the other. Lacan used to like this kind of gnomes. Lacan's theorization starts with the mirror stage, the first stage, and this is very different from the mirroring phenomena that Kohut talks about. Kohut's mirroring goes into the 5 A's: acknowledgement, attention, acceptance, affection, admiration. Lacan's mirror stage is quite different from Kohut's, the way Kohut uses the word the mirror stage, or not mirror stage, Kohut uses the word mirroring as a phenomena rather than a stage. Lacan's mirror stage is when the baby sees itself in the mirror. In earlier times, before the mirror, it would be in the eyes of the mother, in the eyes of the others, or in the way others treat the child. But now, for all practical purposes, it is the literal mirror. And the child sees the image of one coherent whole individual in the mirror. But inside himself, he feels as though he is completely disjointed, disintegrated, disorganized entity. He doesn't feel himself as one cohesive, harmonious whole. He doesn't see alignment inside of him. He doesn't see order, he does not see coordination, does not see alignment, long away from harmony. So he sees this primal, terrifying disintegration inside, the terrifying chaos inside, and in the mirror he sees one stable whole, giving the image of a cohesive whole. And this creates a problem what to believe in. Should the child believe in the authentic, terrifying chaos inside of him? Or should the child believe in the one good-looking, stable, calm, cohesive whole that the physical appearance gives the impression of? So should he believe the mirror image of the physical body, which seems to be stable, cohesive, one, aligned, and nothing is disjointed there? Or to look at the inner reality? So there is a difference between the stable physical form as it appears from the outside and the internally felt terrifying chaos inside. And between the two, the authentic, primal, terrifying chaos inside and the seeming image of a one cohesive, stable whole that the look of the physical body gives, the person, the child, decides to believe in one cohesive, stable, whole image. Putting aside the authentic fact of his inner disintegration, the inner terrifying chaos, the primal chaos. And thus, who am I is answered by accepting that I am the one I see in the mirror, and that I becomes a subject, which is a false subject, inauthentic subject to start with. And Lacan calls this phenomena the méconnaissance, in differently pronounced in French, méconnaissance, I think. And this is a misrecognition. a false recognition, and inauthentic recognition. At its genesis, the subject is inauthentic. Later on, the subject will put on more layers of inauthenticity. But even if all those layers are removed, and if you go back to the subject, the primal subject in Lacanian terms himself itself is inauthentic, and therefore there is no real authentic self to which one can go back to in the Lacanian frame. Even if one goes back to the bare primal subject, that bare primal first subject itself is inauthentic. So there is no authentic space, there is no authentic stance, there is no authentic self to which one can go back to. And this is a very pessimistic thing, that there is nowhere to go. That the best place to go after years of analysis, if one reaches somewhere, is the primal subject who himself is inauthentic. So this is the most authentic point one can reach in analysis, and that is to reach the point of the first inauthenticity. And therefore, as a destination of analysis, Lacan is very pessimistic. There are two pessimisms. One, in Lacanian thinking, this subject, the primal inauthentic subject, is the only subject there is. And this subject, because it was formed first, is always the core of subjectivity of the individual. Lacan does not talk about different subjects. In one of our discussions, we have talked about the biological subject, the social subject, the observing subject, the authentic subject, and the spiritual subject. Lacan does not go into this detailed discussion of subjects because it does not believe that other types of subjects exist. For Lacan, the first subject is the only subject which henceforth grows. So you don't have a situation where different subjects grow at different spaces in the mind at different times, and a subject which grows later can come back and take a space more fundamental than the subject which forms first. Because a subject is formed later does not mean it cannot be more profound and more enduring and deeper than the subject which forms first. Chronology you cannot take to be synonymous with profoundness, endurance, or being near to the destination. But Lacan does not go into these areas or this line of thinking. For Lacan, the subject remains inauthentic, and before that is chaos. So there is a pessimism related to the subject, that there is only one subject who is inauthentic ab initio, and there are no later subjects formed different from this, and in no way they can come and be more profound, more enduring, more truthful, more harmonious, and they can take the place of this subject or something more fundamental than this subject, or convert the chaos before the formation of this subject, the primal chaos, into a harmonious functioning of the self. The primal chaos also in Lacanian terms cannot be converted into a harmonious symphony. In Indian spirituality, this is very different. Not only are there different subjects, but this primal chaos can be converted through spiritual practice into a harmonious symphony. In fact, one has to go through this primal chaos, go through this uh, complete disintegration of the self, of the I, go through the annihilation anxiety which comes with this. But after the practices are done, there is, just as there is a pre-I chaos, there is a post-I harmony. Once you transcend the I, you can come back to the space of the primal chaos and convert it into a space of primal harmony. Lacan is pessimistic on both these points. He was not interested much in Indian spirituality or existential concept of different types of self. So on the point of the subject, he is pessimistic that ultimately it's an inauthentic subject, and in analysis, as the final destination, after all layers are taken off, there is nowhere to go because where you can come to last is this primal subject, and this primal subject is inauthentic. And before this primal subject is the primal chaos. Which cannot be converted into a harmonious symphony. So this stage and this phenomena for Lacan is very important, the middle stage. The next important Lacanian concept is the concept of the lack. Lacan does not conceptualize desire as a positive becoming. He conceptualizes desire as a becoming to fill a void. It's a negative conceptualization of desire. Desire not as a positive uh, rolling out of a positive becoming, but desire as a phenomena to fill a primary lack, a primal void. So Lacan conceptualizes that we all feel there is a lack in us. But Lacan doesn't discuss the idea of omnipotence here in the sense that the Lacanians would do in object terms. The idea of omnipotence comes here in a different way. That we experience a lack, we want to fill that lack, and the lack is like a negative omnipotence. It is not something which can be filled by X or Y. It is an endless lack, and it can be filled only by an endless omnipotence. And because the endless omnipotence can never be had, the endless lack can never be filled. And therefore, there is this endless quest of desire, moving from one object to another to fill this endless lack. And in Lacanian terms, Lacan also conceptualized that often we feel the lack, we try to fill it up, but in the course of growing up, we also conceptualize in fantasy that once upon a time we had everything and there was no lack. I call it the dream we never had. We remember a dream which we never had. We believe that once we had everything and there was no lack, we fantasize this, but actually it never happened that way. But somehow we fantasize it. And the reason can be that this is our primal desire not to have lack. And it is natural that in response to the primality and the fundamental nature of this desire, a fantasy would emerge. A fundamental primal fantasy that we don't have any lack. It is the fantasy of all fantasies. And the first time one feels strongly the lack in interpersonal relationships is when we realize that the object of desire, the mother, does not have interest only in us but also in others. Others can be father and other family members or only the father. And the fact that the mother has interest in others, the mother's interest in others is taken as the others having a phallus we don't have. So the phallus for Lacan is that which others have and we don't have, and is the reason for us not having completely to ourselves our object of desire. So the concept of lack is very important to Lacan, and the lack is conceptualized as the cause of desire, and this lack is in a way a conceptualization of desire as a process, a phenomena to fill a void. It is not the positive rollout of desire. The way desire is conceptualized in Eastern spirituality or many other schools of psychology. The next important concept of Lacan is jouissance. And jouissance is roughly translated as pleasure or enjoyment. But Lacan talks of it as something which is the surplus which remains after a process in which pleasure and pain are entangled in a complicated way. It is like eating something spicy or having the sexual tension and then the release, or enjoying Indian classical music where tension is built up and then released. And this jouissance is very important for Lacan. And this is one of the most confused terms in the Lacanian area. It has become like the term love and socialism. Everyone feels he knows what it means and nobody really knows what it means. Fifth and very important Lacanian concept is the concept of the three registers. Just as Freud conceptualizes the mind as being constituted of the unconscious, the preconscious, and the conscious. And in a way, Jung conceptualizes the model of the mind to be constituted of the self, the collective unconscious, the personal unconscious, and the conscious. Similarly, Lacan conceptualizes the model of the mind in terms of the three registers: the real, the symbolic, the imaginary. Let us start with the symbolic, imaginary, and then we go to the real. Let me just flip it to make it easier. Lacan calls these three registers, and the psychic content of a specific type is present and processed in each of these constituents of the mind, which Lacan calls the three registers: the symbolic register, the imaginary register, and the real register. Let us understand what he means by that. By symbolic, Lacan means that part of the mind which uses symbolic language consciously and which processes information through symbolization. The symbolic is also the space where we recognize the reality of limitations, the reality of prohibition, the reality of law, customs, traditions, desire and fear of society, which does not allow us to do certain things, which incentivizes certain things and disincentivizes certain things. So we accept, understand the order of reality as we see around us, the real world, the practical world, in the symbolic. So one, symbolic is a part of the mind, the register, where content and processing, content storage and processing happens in symbolic form using language. Two, it accepts the limitations, prohibitions, taboos, the dictates of law and abides by it. Three, it deals with the higher part of our mind, the conscious part of our mind. And fourth, it also has to deal with the slip, the distance between what is said and what really is. And this difference has two components to it. One is the cognitive component, that cognitively we can never completely describe something. There is an affective component. We can never completely feel something, neither as it's possible for us to feel, nor in an empathic way the described entity feels. And third, there is of course the philosophical Kantian thing in itself, where we cannot know it completely. So the symbolic order has its own limitations by virtues of rules and laws which govern the symbolic order. Limitations not only of prohibitions, taboos, and laws, but also limitations of the epistemological laws which govern the symbolic. So we have the symbolic. Then we have the imaginary. The symbolic is very much like the conscious mind of Freud. It's almost like the conscious and the pre-conscious put together. It's always difficult by analogy to equate one to the other. So we cannot equate, but we can say there are parallels. So there is no equal to, but we can have rough parallels. And the rough parallel is, the symbolic is a rough parallel to conscious and pre-conscious of Freud put together. Then there is a second register, a second constituent of the mind, so to say, the imaginary. The imaginary is where the all that is imagined, not necessarily with being informed of reality, of laws, of taboos, of limitations, and so on. So imaginary is the field of fantasy. It's almost like the unconscious of Freud. The difference being, in Freud's unconscious, we have part of the superego and part of the ego being in the unconscious and acting there for reality adaptation and also for enforcement of morality. It is not very clear how analogously we can think about in Lacanian terms. So, does the symbolic overlap with some part of imaginary? Of course, yes. It's not a strict parallel like Freud, but there is an overlap. There is a part of the imaginary where the symbolic overlaps it. It's almost like saying the part of the superego and ego are in the unconscious. It's another way of, I mean, let me not say another way, but parallel to it, there are parts of the symbolic which overlap the imaginary and influence that part of the imaginary. And we'll see the overlapping in the monomian knot. So imaginary is the space of fantasy, free from the constraints of reality. There is symbolization in the imaginary, not necessarily linguistic, but there is symbolization of at times using linguistic symbolization, at times using uh, visual symbolization. But this symbolization is not in accordance with the uh, rules of sanity of logic as they are in the symbolic order. So there is symbolization, but the logos is largely kept in the symbolic. The eros is largely in the imaginary and partly in the real. So there is the second register of the imaginary, the register of fantasy. And then we have the real. The real has many definitions, and one of the difficult concepts to understand. This constituent of the mind for Lacan can be defined in many ways. One is, it is the pre-linguistic experience. That before the symbolic started, there was a concrete experience, and that experience is stored in the real. So real is the space of concrete experiences. It is the space of the pre-linguistic. It is the space of the non-linguistic. It is the space where symbolization cannot happen. It's a real space, a concrete space. One definition of the real. The second definition of the real is the reality out there as it is. The real world that we see around us, that is the real. It's neither fantasy nor it is a game of symbolization. It is as there as it is. So the brute reality of everything around us, that also constitutes the real. So the second definition of real is the brute reality around us as it is, without any interpretation. So it is the objective reality around us. The third definition of real is more philosophical. Comes from Zizek. He says, the real is that which resists definition by definition. It is so defined that it cannot be defined. The definition is that it cannot be defined. That is the definition. So what is the definition of the real? The definition of the real is it cannot be defined. So that which cannot be defined is real by definition. So it perpetually resists getting defined. It forever resists a definition. It forever resists the symbolic and the imaginary. And this brings us to a formal definition of the real, that a philosophical definition, epistemologically speaking, that the real is that which resists definition by definition. And the fourth way to define the real is to do it in a negative way, that real is that which is not the symbolic or the imaginary. It's a definition by negation. For Lacan, these three areas of that constitute the mind are very important, and they act in coordination with each other with overlaps. And they come together, the three come together as though these are three rings, round rings, and they come together in what Lacan calls the Borromean knot. Borromean knot means it is an arrangement of three rings which interpenetrate. It is like one ring, another ring, and the third ring. And they interpenetrate in a way that if you remove one ring, all the three come undone. So all the three have to function together in a coordinated mechanism, and this is what is necessary for healthy functioning of the mind. A harmonious and healthy functioning of the trinity of the symbolic, the imaginary, and the real. The three registers have to work with each other, overlap with each other, inform each other, and work together in a harmonious way to keep the mind in the state of health. The more the symbolic is destroyed, the more psychotic one goes. And one of the most acute forms of psychosis is where the person regresses from a commonly shared language into what is called a private language. And then he can regress back more into a more concrete language, and often into a complete abdication from interaction, into a complete withdrawal without any communication, be it of the common language or the private language. The intensity of the real is hard to bear for most, and for many, imaginary is an escape from the real and the symbolic. The real is too terrifying, the symbolic is too castrating, and a refuge from the two is in the imaginary. The next concept is of the small other. Sartre used to say the other is the hell, and then the question came up, who is this other? Is the other my enemy? Is he the state? Is he the police officer? Is he the judge? Is the other one of my family members? Is it my enemy? Or is the other my own unconscious? Is the other my own id, my own ego? Or is the other the law of nature itself? So the word other is a fast moving word. And when we say I and the other, it is I versus the universe. And obviously, other is a much larger category word than the word I. Lacan here is referring to the small other and the big other. And he confines the meaning of the word other to very specific things. It is not as open as the other is the hell. Lacan calls the caregivers and the immediate family members as the small others. And the law, the society, the culture, the language in which we find ourselves and what are given to us as a community constitutes the big other. The big other is the state, the culture, the language, even the laws of nature. All that is given to us, not only to us, but to the community, to every one of us. It is something which is given to every one of us. Small other is something that is given to us as an individual. Big other is something that is given to all of us as a as all given to all individuals that constitute the community. So the small other is the individual other, the big other is the community other. The big other actually is everyone's other. The small other, the family members, they also create prohibitions, taboos, castrations. They also go into, there is a phenomena of loss and attack with the small other, which Lacan does not pay much attention to. The Kleinian ideas of object loss, object attack, object unpredictability, all of which happen with the small other, but that is not central to the Lacanian conceptualization. What Lacan brings in as a stroke of genius is the big other. I think one of the greatest contribution of Lacan is in the idea of the big other, to bring in culture, law, language, state, everything that is given to every one of us, and which influences the way our mind works and our life rolls on, the big other. On this, I have discussed separately in an episode. The title is The Father of the Big Other. That the big other, the given to all of us as individuals, not to me, but to all of us as individuals, what is given, what is the big other for all of us. Does the big other just get constituted by accident, by chance, or are there laws that create the big other? Is there a big other, a father of the big other? And that would take us to the laws governing the historical nature of things. Eighth, very important for Lacan, is the small other learns from the big other, and the big other directly and through the small other introduces the element of logos, element of limitation, element of prohibition, castration, and this Lacan calls the name of the father. Father to denote logos. So if mother is eros, father is logos. And the name of the father is the name of the law, the logos, the tradition, the state, the primal prohibition. So the name of the father is the castration. It is the prohibition. It is the taboo. And father here essentially refers to the logos. Or you can call it prohibitos. Lacan also talked about very important concept, object-patia. Object-patia is the object cause of desire. So for Lacan, lack leads to desire, desire leads to the search for jouissa, jouissa is prohibited, and that in turn fuels desire. Simple way to understand this is, we can think of desire getting activated in two ways. Desire getting activated by itself, or desire getting activated because an object of desire, a potential object of pleasure, presents itself to us. So I can feel hungry because I have not eaten anything and the glucose is going down, and the desire activates. Here the desire is activating on its own. Or second possibility, I have taken my lunch and I go out and I'm not particularly hungry, but somebody presents to me before me something which is my favorite, and I again develop an appetite to eat it and I eat it. Had somebody not presented it to me, I would not have sought out that thing and consumed it, which means the object of pleasure presenting itself activated the desire in me. So if you look at desire activation in two ways, self-activation of desire because of a variety of factors, which we have discussed in desire activation in the heat model. So a self-activation of desire based upon a number of factors, and activation of desire by an object of pleasure presenting itself. The second form of desire activation, Lacan refers to by that object which activates our desire as object patiya, the object cause of desire activation. Lacan does not focus so much upon the self-activated desires, nor upon the reasons or the laws by which the self-activation of desire happens. Lacan is more interested in the object-activated desire. And that makes Lacan's conceptualization of desire partial, because it does not go into the self-activation of desire and what are the reasons which govern the self-activation of desire. Borromean knot we have discussed. So these are 10 core, should not say core, but important concepts of the Lacanian thinking. Now let us move to the next part of very important part of Lacanian thinking, the Lacanian system of diagnosis. The diagnostic systems have moved. Early days, we used to have a diagnostic system of neurosis, psychosis. Later on, it became neurosis, borderline psychosis. Then slowly we moved to DSM type of diagnosis. Before that, we had the CBT-led structure of diagnosis. Lacan moves into a different framework of diagnosis, very different from DSM. And he creates a diagnostic system where everything is divided, all disorders are divided into three categories: neurosis, psychosis, and perversion. Neurosis is what we would call, in Freudian scheme of things, drive frustration. That we have a desire, the desire is frustrated because of reality or morality, resulting in some pathological stalemate we call neurosis. Second is psychosis, where there is a break of reality testing. It is inability to bear with what is inside of us, that we create a customized world in a way that our reality testing is impaired. And the third category is perversion. perversion means a desire not to be acted upon is acted out. What normally would be dealt with by defenses is put into action. This is perversion. So Lacan puts all disorders into these three categories: neurosis, psychosis, perversion. Now, why only these three categories? Why not 4 or 5? And why only this? So the natural question is, why only 3 and why only this? Lacan says that if we look at the primary psychic functioning of all disorders, we see 3 types of psychic functioning. In one type of psychic functioning, the disorder essentially is based upon repression. That a strong desire is repressed, and this unhealthy stalemate results in a psychological trouble. So the core mechanism at work is the mechanism of repression. In second category of difficulty, psychosis. So in first category of difficulty, neurosis, the core mechanism in intrapsychic functioning is of repression. In the second category of difficulties, psychosis, Lacan says the core difficulty at intrapsychic level is of foreclosure. Now, what is foreclosure? Foreclosure means closure before the due time. So closure of what and due time for what? Lacan says before the name of the father could be written completely, there was a foreclosure. The name of the father could not be written completely. There was a foreclosure, and therefore the name of the father could not be written at all, could be partially written, or was left incomplete. And this, all these three is what is called foreclosure. It is like you close the door before the name of the father can be written. And what is the name of the father? It is everything that controls, that coordinates, that prevents, that presents a taboo, prohibits. Essentially, it is the capability to coordinate. It is a regulating mechanism, the coordinating mechanism, the controlling mechanism. So the essential controlling mechanism, before it could be built fully, doors on that formation, that phenomena were closed. That phenomena was truncated before it could complete itself. And therefore, there is a foreclosure. In Lacan's terms, in normal terms, we would say the mechanism of reality, of coordination, of control, of adaptation, which was, that mechanism was in the process of getting created, and that was stopped prematurely. In Lacan's language, we would say there was a foreclosure before the name of the father could be fully written. Now, at what stage the foreclosure happens determines the severity of psychosis. There can be a complete erasure of the name of the father, to a partial erasure of the name of the father, to the name of the father almost being complete. Or there can be a temporary erasure of the name of the father. Thank God he did not say the surname of the father. So the core mechanism in psychosis in Lacanian approach is foreclosure. Foreclosure before the name of the father can be fully written. The third category is perversion. Here, there is disavowal. So the name of the father is fully written, but the psyche refuses to read and obey the name of the father. At times it cannot read. At times it refuses to read. At times it reads but refuses to obey. Either ways, there is disavowal of the name of the father. The drive is so high and the name of the father is not strong enough that the net result is the disavowal happens. And this leads to acting out of what should have been dealt with by defenses. And this also brings us to the core difference from Lacan's point of view between structure of the personality and the symptoms that we see. That the structures of the personality essentially are three: neurotic structure, psychotic structure, and a pervert structure. And symptoms can be many. So we can have a person with a neurotic structure and a psychotic symptom. So he comes to you with a symptom of psychosis. But if you go deeper, the structure actually is neurotic. And in such cases, prognosis is good. If a person comes to you with a psychotic symptom and a psychotic structure, the prognosis is difficult. The person may come to you with a neurotic symptom and a psychotic structure. We have to be very careful in therapy that we don't precipitate a psychosis by too deep, too quick, too difficult a frame that we impose upon the person. And we may have a person coming with a neurotic difficulty with a structure of perversion. And we have to be very careful about what is the structure we are dealing with. In case of perversion, the stance has to be of strict implementation of the frame and strict implementation of the superego. Any conversation on openness can be seized by the perverted structure, even if the symptom is neurotic, and we can see perversion appearing as a behavior, although he never came with that difficulty. So we have to be clear both about the symptom and the structure. That what does a symptom require in terms of therapy, and what does a structure, underlying structure, require in terms of therapy. And this, I think, is another very valuable contribution by Lacan of the structure underlying the symptom. Let us go into slightly more details. When Lacan talks about neurosis, he further divides neurosis into hysteria, obsessional neurosis, and post-traumatic disorders. Psychosis he divides into paranoia, schizophrenia, melancholia, and bipolar. Very important, bipolar he puts under psychosis, not under neurosis. Because in mania, we see the effects of foreclosure of the name of the father. And in perversion, He puts sadism, masochism. If you want, you can put psychopathy and sociopathy. What about other disorders? They would get either under any of these headings, subheadings. They would become sub-classification to this classification, or some of them may get a place in the main classification. But the core structure of diagnosis, neurosis, psychosis, perversion, that remains. And the focus on structure and symptoms, that remains. So the entire DSM has to be put under the three: neurosis, psychosis, perversion. I'm referring to, out of 22 chapters of DSM, 18 chapters are those which are psychology heavy, others are bio heavy. Leave apart the bio heavy, but those which are psychologically doable, so to say. So about 18 chapters, and if you take 5 disorders per chapter, we are looking at 90 disorders. All of them will get classified. All the 90 DSM disorders will get classified under the three: neurosis, psychosis, perversion, either directly or as a subcategory of these subcategories. Now coming to the therapy part of it. What have been Lacan's contributions and disasters? Lacan introduced a variable session. And this has been always controversial and always will be, because it's an extremely complicated tool to deploy. There are too many ifs and buts, too many contextual variations for deploying this. Variable session means you don't have to have a 45-minute, 50-minute, or 1 hour of fixed session. Usually we have fixed sessions. You can have a 15-minute session. You can call a person saying the regular session will be of 45 minutes or 1 hour, but in between, anytime I feel it is the best time to stop, the session will be terminated. This is called the variable session. And it keeps the patient on the tenterhooks, always active, doesn't waste time, doesn't talk about immaterial things. So in that sense, on a per minute basis, it enhances the productivity. But what does it do to the anxiety of the patient? And what about all those phenomena which happen when nothing is happening, or when holding is happening, or when productive silences are happening, or when internalization of the quiet space of therapy is happening, or when the internalization of a good, reliable, stable object and feeling safe with him is happening? How do you build safety, which is so important, with a variable session? There are many nuances to it. One, if you have a unidirectional variation, by that what you mean? You say, I will have a 1 hour session. It may go up, but not down. So I can have 1 hour, 10 minutes. I cannot have 50 minutes. It's a unidirectional variation. That is still fine. But to have bidirectional variation is to introduce a kind of bipolarity at the level of affect. Loosely speaking, I'm not talking bipolarity in the DSM terms, but loosely speaking. And the terminating the variable session is called sanction. And here, at what point to terminate that session is very important, because the patient keeps thinking about it for a long time, and that does a lot of things to the patient. So termination here is an act of interpretation. That the point at which you decide to terminate is an act of interpretation. It's an act of creating a mystery in the depth of which the patient goes to find more of himself. This would be fine for patients who don't need safety and holding and who are ready for challenge and confrontation. This would be also fine for patients who have had enough of stability and they don't need any more reliability and stability of the fixed duration of the session. But for most people, this is far more counterproductive than productive. I'm referring to bidirectional variability of a variable session. Most seriously challenged patients need safety. And safety comes from predictability, reliability, and holding. It doesn't come from unpredictability, challenge, or confrontation. There are 4 types of patients. We have discussed this before. Category 1, who cannot be given any form of psychoanalytic psychotherapy because the bare application of frame itself is disintegrating. Very fragile patients. For them, a spiritual approach, a non-psychoanalytic holding approach is far more productive than a psychoanalytic approach. Second category of patients who can be given holding, who can be brought into psychoanalytic therapy, but you can practice only Cohesian holding stance. You cannot practice the classical interpretative stance of psychoanalysis. Only after a long time, they come to a stage where the classical interpretative stance of psychoanalysis can be activated. Third category of patients who are the cutout for psychoanalysis patients, ready for interpretations. And the fourth category of patients who are ready not only for interpretations, but also for challenge and confrontation. The first category is not cut out for psychoanalysis altogether. Not as yet. And would be not as yet for a long time to come. Second group of patients cut out for holding stance, a Cohesian stance of psychoanalysis, focusing more on holding and safety. Often stretching out to support. At times even stretching out to gratification by omission. Of course, not by commission, but gratification by omission. Third category, cut out for classical psychoanalysis. Fourth category, cut out for intense approaches like that of ISTDP or EDT or ECT workshops and so on. What fits into the variable session mode are the fourth category of patients. Some of the third category patients also can possibly positively benefit from it. But the first two categories and much of the earlier part of the third category, for them, this is not the productive approach. In reality, what happens is that usually the therapist starts with a fixed session like classical psychoanalysis for a long time, and only after a reasonable amount of time, the variable session is introduced. Another important element of Lacanian conceptualization is of articulation of desire. It's very important Lacanian therapy, and this is something I think we should learn from Lacan and take into our work. The sheer articulation of desire in the safety of the therapy space. And this has stages. First is the conscious stage, the top of the mind desires. Then deeper desires, many of them entangled with some form of shame or taboo, or unbelievability or unreality. And then desires of free association. And as it deepens, the free association, as it deepens, it moves from a neurotic free association to almost a psychotic free association. And that is where real articulation of desire happens, to the extent that the articulation of desire exhausts much of the power of that desire. The exhaustive articulation of desire is a great relief provider and a great insight provider and self-knowledge provider to the person. And this is a very powerful technique of exhausting desire by an exhaustive articulation of desire. Most therapists start getting anxious and jittery when the desire becomes deeply spontaneously flowing in free association and often borders between the neurotic and the psychotic. If the ego strength is high enough, you can actually go in the articulation of desire even to the disjointedness of communication. Synthom is a very important Lacanian concept, and a concept which brings in a lot of humility and realism. A great change, at least for once, for Lacan. Synthom is related to the word symptom in one way. And one understanding of synthom is the symptom is so exhaustively understood, so profoundly accepted, so deeply detoned by catharsis, so deeply revisited so many times, that much of what is related to the symptom is exhausted. The result is 75% of the symptom is not troublesome anymore. And here we have to differentiate between the symptom and the suffering. When the symptom is divorced from suffering, because you understand it so profoundly, you have revisited it so many times, you have catharted out affect related to it, you have reflected upon it from so many different standpoints, so many different ways, cast it into a existential journey, felt it through, assimilated in, synthesized consciously, it gets into a situation where the symptom is divorced from suffering. 50 to 75% of the symptom is cured. What remains, you live with it as a friend without much suffering. So there is a 50 to 75% cure. There is a 20% suffering. 80% of the suffering is gone, even though there is a 20 to 30% remaining of that symptom. So that symptom, which has divorced itself from suffering, much of it has got healed, exhaustively been worked through, and what core remains is going to be with us uncured, but not bringing us much suffering, though it brings a limitation of life. That worked through symptom, that sanitized symptom, that uh, treated symptom, that domesticated symptom, now you live with as a difficult companion, and that is called a symptom. One discussion I have in one of the episodes I have discussed, the title is Symptom Not a Cure. One way to look at it is pessimism. Second way to look at it is realism. For many with chronic difficulties, deep-seated difficulties, the best destination in analysis would be to move from a symptom to a symptom. And this is a radical change in the quality of life, although it is not a cure at the roots. This is true of much of deep-seated psychosis. This is true of much of deep-seated personality disorders, that the best you can do is to move from symptom to symptom and then live a great life compared to the great difficulty with which you went into analysis. From a therapy standpoint, the goal from a technical process standpoint in the Lacanian area is the goal of therapy, Lacanian therapy, is to empty the real and imaginary into the symbolic. And of course, it's an ideal. It's like making the whole unconscious conscious. It's an ideal. Nobody reaches there. But the ideal stated would be this, emptying the real and the imaginary into the symbolic. At the end of it, how do you reflect on the whole of the edifice? Lacan loves registers, so I have put the entire Lacanian framework, Lacanian ideas into three registers. The original, the repackaging, and the rubbish. So all Lacanian ideas you can divide into three. There is a group of ideas which are very original, very profound, very enriching, and they are works of a genius. Those ideas of Lacan I would put into the first register, the original, which is what we should all learn, enrich ourselves with, and take back to whatever we are practicing. The second is the repackaging. Many of the Lacan's ideas are repackaging of something already said in psychoanalysis or philosophy or somewhere else. And the third is utter rubbish. Third register is where he puts in rubbish in good words. One thing common between Lacan and Sartre is both are magicians of words, very good at words. So the original has to be enhanced, adopted, enriched, developed. Repackaging has to be seen through, the fallacies laid bare, confusion ended, and the rubbish has to be discarded. Lacan loves gnomes, and one of the gnome I have for Lacan is Lacan needs a tranquilizer. The great thing that Lacan did was he brought in society, art, philosophy, culture into psychoanalysis through the great concept of the big other. The big other is a really big concept, and we are yet to fully develop that concept into its elementals and processes. He brought in the concept of the functioning psychotic. Many great artists actually are functioning psychotics who are hanging from the Borromean knot. Right? Another important area that he put forward was the primal terrifying chaos from which mechanism happens, and we develop the false subject in the first place. This takes off in very different ways. This is at odds, not at odds, but this in a way, if we look at Freud's idea of primary narcissism, we are looking at primal omnipotence, primal bliss, primal ecstasy, exactly opposite of this primal terrifying chaos. If you look at that Freud's oceanic, blissful, ecstatic, omnipotent experience, and if we look at this primal chaos, they are the two ends of spectrum which the infant feels before I is fully formed and the coordinator starts functioning. Lacan does not index the primal terrifying chaos that he finds inside with the other extreme of oceanic feeling, complete trust and security, bliss, ecstasy, self-sufficiency in the state of primary narcissism. So actually, the state of primary narcissism, the state of complete disintegration and this primary terrifying chaos, and the state of object relations, all the three states are what the infant usually passes through. So the period that Lacan is talking about does not only have the primal terrifying chaos, it also has that pleasant state of primary narcissism and the stage of object relations. And for a few hours, the infant passes through all of them. So that is a limitation of it, but a very important concept. It sort of rounds off the primary narcissism and object relations with a bottom layer of terrifying chaos, and the three put together very well describe the complete spectrum of states through which the infant passes through. So into itself, it's a very limited concept, but put together with what Klein and Freud says, the three complete a conceptual triad. And this is again at odds with the Hindu spiritual reading of it and experience of it, that nothing can be done to a pre-I situation. In spirituality, you transcend the I. So you have a pre-I situation, I situation, and then post-I transcendence situation where the I is deactivated. And yet the harmony prevails instead of this terrifying chaos. So that level of self-transformation is possible. And that's a very optimistic view of human nature in Hindu spirituality compared to psychoanalytic view, which is more pessimistic. What Lacan brought about was a more comprehensive comprehension of psychoanalytic concept. Very true. For example, how do you look at the Oedipus not only as a sexual phenomena, but also as an emotional phenomena, also as a cognitive phenomena, also as a linguistic phenomena? So the more aspects of a phenomena you read into, the better you are able to more comprehensively understand that phenomena. So that Lacan expanded and brought in that more holistic comprehension of phenomena which were otherwise understood from a one limiting perspective. And this holistic comprehension we are dealing with in the school integration series, You can see videos in this series of how you can take one phenomena, say the oral stage, and what do other schools of psychoanalysis say about the oral stage, bring them all in and have a holistic understanding of the oral stage. Same with anal, same with phallic, and so on. The school integration series goes into that. If you're interested, you can see that. And I think one of the great acts of humility was to recognize the idea of the synthom. The spelling wrong. So synthom often can be the best point you can reach in psychoanalysis, and we have to tame our narcissism, which always wants a complete cure and a quick cure. With this, I have done a very quick and a very short overview of Lacan for sane non-Lacanians. Questions will come up. A lot of questions will come up. Feel free to write to me if you have questions. To the extent I can, I'll try to address them. Thank you.